We have over 1,300 stroke admissions at Norton Healthcare, which is one of the largest number of stroke patient admissions in the region. We have optimized our system to take care of that very large volume of stroke patients on a daily basis.
It really shows Norton Healthcare's commitment to stroke care in the community. It shows that they've brought together the resources and the talent to provide an excellent stroke program. It shows that we've had the processes put in place that for every stroke patient gets the same treatment, and the more that we do it, the better that we get, the faster that we get, and the better the outcomes that we have for the patient. By having a center that's certified as a comprehensive center, it really shows the community that we're here to serve you and that we have the people and the talent to do so.
We have a big problem in our community in recognizing stroke. Stroke symptoms are sudden onset, weakness or numbness of arm, leg, or face, usually on one side of the body. Sudden onset, drooping of the face. Sudden onset, confusion, difficulty speaking or understanding speech. Sudden onset, dizziness, vertigo, or difficulty walking, or sudden onset, worst headache of life. All of those things, you notice it was sudden onset was the first two words for all of those symptoms. All of those symptoms are what can happen when you get a blood vessel to a major part of the brain blocked. So it's important to recognize those. And when you see someone is having stroke symptoms, to get them very quickly to a comprehensive type stroke center like Norton Brownsboro Hospital, so they can have access to medical and interventional care.
During our drill today, we were able to implement our stroke process, which allowed a patient to call 911, be brought to our facility. We implemented our stroke protocol, had them get a CT upon arrival. We had blood drawn, IV started, and we were able to give them medication to help with their clot that was occurring to get them back to recovery.
What we learned from each drill is we look at processes to see where we could shave minutes off. Minutes mean brain cells. It's our duty to look at everything with an open mind, anything that we really think might work well. Did it really work well? Was there processes that have gaps in minutes? And then again, hardwire into the staff why each step is critical that we don't bypass steps.
In the setting of an acute stroke, like in this drill, my job is to physically remove that blood clot or particle that's blocking flow in the major blood vessel to the brain. And the way we do that is we get the patient into the angiography suite, which is in the operating room here at the Norton Brownsboro Hospital, as fast as we can, and we access the arterial system by accessing the femoral artery in the leg and put a catheter in there, and through that fish up another smaller catheter and go up all the way into the affected carotid artery in the neck and up higher where the clot is. We go and engage the clot with the smaller catheter. We deliver a device, a stent retriever device, a small device that looks like a stent on a wire, into the clot. When the device has engaged the clot, after a few minutes, we pull that device along with the clot out of the patient's body. That's how we restore blood flow to that part of the brain. It is extremely important that that be done in a very timely manner. Every second and every minute counts. It's estimated that every minute that there's lack of blood flow to a part of the brain, approximately 2 million brain cells or neurons die. That's 2 million brain cells dying every single minute that the blood flow is stopped to a part of the brain.
So it's important to get treatment very quickly because we know that the brain ages about 3.5 years per 1 hour of ischemia. So if you have 10 hours of ischemia, that can lead to about 36 years of age that your brain accumulates over that time.
It's important that everyone understands how fortunate we are to actually have, a comprehensive stroke center and the outcomes we can give to people.
A lot of work goes into being a Joint Commission certified comprehensive stroke center. It's everything from the care paths that we establish for patients that have subarachnoid hemorrhage and intracranial hemorrhage and ischemic stroke, but it's also working with our EMS colleagues to help them to understand the importance of stroke and the time really is brain and getting them to the ER quickly. It's also the advanced technologies that we have for imaging. It's also the teams that we have for stroke intervention. It's the neurologists, the neurosurgeons, the therapists, the nurses. All of those come together to make a comprehensive program.